1.5 million Americans are living with or in remission from a form of blood cancer. Many of these cases are B-cell lymphomas that often develop in adults older than 60, but can also be diagnosed earlier in life. Astrid is joining us now. She is a survivor after being diagnosed at 29, alongside Dr. Matthew Lunning, a hematologist at University of Nebraska Medical Center. You both are joining us to help raise awareness of B-cell lymphomas during Blood Cancer Awareness Month. Thank you guys so much for joining us.
Of course.
Thank you.
So doctor, let's start with you. What type of cancer is this and how is it caught?
Yeah, so I am a blood specialist. I specialize in lymphomas, and I was part of a clinical trial, Breyanzi, which is a CAR T-cell therapy that I'm here to talk about for large B-cell lymphoma. Both Astrid and I are compensated for our time by Bristol Myers Squibb. Large B-cell lymphoma is the most common non-Hodgkin's lymphoma. There's over 60 different kinds of non-Hodgkin's lymphoma, and diffuse large B-cell lymphoma is a very aggressive non-Hodgkin's lymphoma, and it impacts individuals with a median age of 66 years.
Geez. Now, Astrid, you were younger when you were diagnosed. Can you talk to us a little bit about your journey, Astrid, and how it's affected your life?
Yes, unfortunately, I was very young. I was in the prime of my life at 29 years old, going to school, recently married, and I started having this itching all over my body that followed with flu-like symptoms on and off, night sweats, chest pain, back pain, and I ended up in the emergency room with severe chest pain, and then I was told that I had a huge mass inside my chest. After that, that led to my diagnosis of diffuse large B-cell lymphoma, and I had to undergo aggressive cycles of chemotherapy for about 6 months. But unfortunately, when I thought I was done, my cancer came back pretty quickly after that. So at that point, I was left with the choice of doing a stem cell transplant or enroll in a clinical trial that had CAR T-cell therapy. And I went with the CAR T-cell therapy treatment.
And how did it work for you?
So the first 30 days were very difficult. I had a lot of fatigue, but then over the next few months, I started to feel a little bit better. And then by 6 months, I got the good news that I was in complete remission.
Oh my goodness, this is incredible. So doctor, tell us a little bit about this CAR T-cell therapy.
Yeah, so CAR T-cell therapy is a form of immune therapy. So we actually pull out Astrid's T-cells. We send them away where they're re-engineered and re-educated to be better killers of lymphoma. So often they go right back in the same vein that they came out of after about 3 to 4 weeks of manufacturing. In the trial called the Transform trial, CAR T-cell, this Breyanzi, went head-to-head against our standard of care, which had been higher doses of chemotherapy and an auto transplant. And more patients in this trial achieved a complete response, and those complete responses were durable, and the primary endpoint of the study was positive in favor of the CAR T-cells. It should be noted that CAR T-cells, aren't a walk in the park, so there can be cytokine release syndrome, neurotoxicity, and the possibility for secondary cancers. So it is incredibly important to stay, frequently visiting your healthcare providing team. And if you wanted to have more information about Breyanzi, you can go to the website breyanzi.com, spelled BREYANZI.com.